Welcome to Beneath the Branches, the podcast for the Adoption and Foster Care Clinic where we sit in the shade of shared experience. The heart is normalized and belonging is built one honest conversation at a time. Adoption, foster care, or kinship placement brings deep joy and real challenges, and we're here to talk about all of it. The hard, the heartwarming, and everything in between. So grab a cup of coffee, take a deep breath, and join us as we hold space for the messy, beautiful work of building connection beneath the branches.
Welcome back to the Adoption and Foster Care Clinic podcast. Today we're going to talk about trauma-informed care. What is it?
Yeah, and so when we were talking about trauma-informed care, we were just kind of like all realizing that it's such a big buzzword right now. And you can't like look up any other professional in the mental health field and not see the words trauma-informed care. But if you interact with multiple therapists that say they're trauma-informed, that may look differently depending on like their specialty, their clientele. And so we want to talk about it, right? In specifics to our population, but also how it shows up for us, how we utilize it in our own practice with our clients.
Yeah, I mean, I think you have to look at trauma first, right? Because it's trauma-informed care. So trauma, what is trauma, and where did this trauma come from? I always think about like kids. All kids experience stress, right? All kids experience some level of stress, and some stress is good, right? Some stress teaches you to cope and to learn from your circumstances. But the kids that we treat typically have had toxic stress, which is stress that's continuous and chronic, and also in absence of a primary caregiver that is lovingly helping them through that. So when I think of trauma-informed care, I have to think of like, who am I offering this to, or who is this important for? And it would be, in our clinic, the children and parents who've experienced that chronic stress.
Yeah. And I think it goes back to something we were talking about earlier of asking the question, like, what happened to you versus, why are you like the way you are? Or
Exactly.
Mm-hmm.
Yes.
Or what's wrong with you, rather,
I think like a key point for our population specifically is not just the traumatic event itself or this like chronic stress, but the fact that it's happening at key developmental stages too.
Right.
And that's why it's so important for our clientele and the families we work with to have an understanding of trauma-informed care, is because our kids have had trauma while their brain has been developing. Sometimes at the most vulnerable stages, we're talking about prenatal trauma. And so the very core of their little brains being shaped has been shaped with the impact of high cortisol, the exposure of trauma, and that it's pervasive. It shows up in development, it shows up in behavior. And if we don't understand trauma and its impacts and we don't utilize trauma-informed care, we're missing a huge need of the kids and families we work with.
And it makes it really easy to blame the child, when you don't have an understanding of how trauma impacts the brain and all of who you are.
So like going back to the initial question, Kelly, what would you say, like how does trauma-informed practice show up for you with your clients?
Yeah, well, I think like a couple of key components. Safety is really important. So, as, clients are coming into the therapy room and even clinic, like I think that's really important, is to create a safe environment. You're not always going to be able to reduce all triggers, but like, the way the clinic is set up. So it looks more like a living room versus a hospital or a doctor's office. I think it's really important. And then in the therapy room, like one of the first sessions with kiddos that I have is we come up with like a code word, like I make the promise to the kids that I'm working with that I will never pressure them to talk about something that they're not yet ready to talk about. And some kids, depending on their age, developmental level, they don't feel comfortable saying no to a grown up, and so we come up with a silly code word that they can say if they're not comfortable, and then we move on. And I tell them, that doesn't mean I'm not going to ask them again at some point in our therapeutic relationship, but it means that I will wait. I'm going to respect their voice and respect them, and we'll come back to it, So safety is really important for trauma-informed care. I think, again, looking at the whole child, and we do that as a clinic by just, again, being an interdisciplinary team. I think that's really important for trauma-informed care, So safety, seeing the whole child, I think those are a couple of the key components of like my work with my clients.
I think one of the things I've learned from Kelly too is regulation being a key factor in therapy, especially for kids. Like you have elements of regulation in your work with them. So that's like by providing fidgets, by providing multiple ways to engage with a child. So if they are coming in with a lot of energy and they can't seem to sit and focus, you bring in activity, you throw a ball back and forth. So there's all these different multisensory ways to engage a child. And that's trauma informed, seeing the child where they're at and bringing those elements in to help regulate them. And I know regulation is a big key part of trauma informed parenting. I know Dr. Chambers, I feel like we were talking and had a really good conversation about that. I don't know if you could share more on what you've seen.
Yes, because you've got, like a newborn is completely regulated by their caregiver. They rely on their caregiver for everything, their warmth level, their eating, they're regulating their every emotion. And then as you get to the toddler stage, then it's more of a co-regulation system that keeps that child regulated. So the child is regulating some themselves, but they're needing the parent. They're turning to the parent to say, I want some more goldfish. But they're also able to initiate more their own regulation. And then they advance, of course, to being able to self-regulate eventually. And so many of our kids just missed that stage where a parent was able to regulate their emotions. And then all of a sudden they're in this new family, and this family's expecting them to self-regulate, but you really do. You have to go all the way back down to that newborn stage. I used to think about that, like even with my daughter who was adopted at 12, just in my mind thinking, she's a newborn on the day-to-day, so that I would not forget that I needed to fully regulate with her in order to one day her self-regulate. And that's trauma-informed care. That's remembering the trauma that the child went through, remembering that first year, when the most important thing you learn in that first year is I can trust. And that was dysregulated, so we've got to go back and build that first skill that was so important and that may have been missed in our children of I can trust in order to teach them regulation, which will eventually impact their behaviors.
Bruce Perry, we got to see him speak at NCFA one year or like a permanency conference, I don't know. And it was like the first time I heard him talk about how even from a newborn, when you're holding your baby and shushing them, like that level of co-regulation, and he just related that to sleep patterns. When we have newborns home domestically adopted, how when they cry out, like why we don't sleep train them, because they need that repeated response of a caregiver. Like I've cried out. It doesn't matter if all I needed was just to see your face. Like that's reaffirming who you are to that child. You're confirming your role as their primary attachment figure, and just doing that bounce of like shushing and bouncing. Like that's just, it's magic. It seems so simple. But you have to, as a parent yourself, you have to be regulated enough to show up and do that when your kid is losing it, when you've got like your colicky baby and you're, just doing that. It's so hard.
And it's so hard to remember when the child is 6 and needing that.
Yes.
It's the middle of the night. 6-year-olds should sleep through the night, but not our kids. That's not the expectation we have to have with them. It doesn't mean that's not an expectation we want. But we've got to keep thinking, okay, what does a newborn want? What is this that the child didn't get that we need to reestablish and rewire those neurological pathways so that child has that firm foundation that was missed.
Yeah, I think that too, like talking about all these different ways trauma shows up, I think can be some discrepancy in the adoptee population, especially about like, okay, if you were adopted as an infant versus being adopted as a toddler or as a later adolescent, like who has more trauma? And I think the important thing to know is that all instances contain trauma and all of them are impactful and all of them require trauma-informed parenting and responses. So like from an infant perspective, even though there's no actual memory tied to that break in biological attachment, it still impacts development because that child was formed inside of their mother's body, and they grew and developed with her sound, her cadence, her environment. And part of that biological process is they're born, and then they physically match what they've heard and felt and experienced with their physical body. And when that does not happen, when they cannot make that physical connection, there is a shift in their neurological development where something that was supposed to be here now is not here, and there is no sense of safety. That sense of safety should be automatic for biological children. They are transferred from womb to physical connection. And when that does not occur, there is no safety, and everything is unknown and unfamiliar. And I don't know what could be more traumatic for your very first life experience to be loss, to be lack of familiarity. You've been thrust out of your environment, literally. And now there's no familiar connection piece. And then you're passed into the arms of people you don't know. And sometimes a very excited adoptive family will pass that baby around to several different people that are so excited to meet them. And again, where is the consistency in care? Who is that person when the lesson number one is I can trust, and you cannot even find that one person that you were supposed to be continuing that relationship of trust with? And so that is for all of our families to know that even though trauma happens at different stages, it is impactful and it changes neurological development, and trauma-informed parenting is required to help these kids develop and learn that lesson of I can trust.
Right. And going back even further, a lot of the children that we serve, they've experienced in utero trauma. Right. Their moms have been in domestically violent situations and relationships. There's been in utero exposure at times. And at the very least, if a mom is considering an adoption plan, she's been in a tremendous amount of stress, which all impacts the brain, which all feeds into the baby.
Yeah, high levels of cortisol, So, and that, like Kelly said, that changes brain development. And then that leads into how we parent. If we parent in a way that is I'm not going to respond to my child's every cry, then we are creating more opportunities for them to experience higher levels of cortisol when they've already had such a huge dose of that prenatally.
And like you mentioned too, with substance abuse, if that it occurs in pregnancy, those are significant stressors on the newborn brain. Yeah, that then those propensities to have those higher levels of stress extend beyond the newborn period. Yeah, I think, when a child, we think of children as being resilient, oh, they don't remember what happened to them, or thank goodness you got them at a younger age because they won't remember. But children are more malleable, which would mean they're easily formed during that time. So things that happen to them have a deeper imprint on their brain. It's not always conscious. It's more of a subconscious thing that happens to them, but that memory is always going to be there in their body. So it's even more important, I think, when it happens younger, and especially over a long period of time.
And I think that is, one of the reasons that CBT is not super helpful for our kids.
And what's CBT again? You want to explain to everybody?
So CBT is cognitive behavioral therapy. And in CBT, you have to use a lot of it's all about connecting thought, emotions, behavior. And some of our kids, depending on their learning differences and their developmental level, again, the trauma that they've experienced, a lot of our kids can't reach that point. They can't connect all of those things. And what you were talking about, a lot of our kids have experienced pre-verbal trauma. And, their body remembers, but their brains don't necessarily remember. And so you have to use a lot more somatic techniques with them before you can even reach the point where they're ready for something like CBT. So I think that goes along with, again, being trauma informed as well, kind of knowing those things, having lots of tools in your toolbox that you can pull out to kind of engage that kid, engage that person. When traditional, again, CBT works with a lot of people, but for some of our kids, not so much.
And you should, I think, probably maybe break down somatic too, because I think before I was a clinician, I wouldn't have known, So like, what does the somatic aspect of therapy, or just, knowing things? What is it?
Well, for me, it's the brain-body connection, like doing a lot more work in the therapy room where you use movement and you use the body, because again, trauma is held in the body a lot of times. And so at points where you can't reach, that trauma in a cognitive way, you do it through, different exercises using the body, lots of regulation, co-regulation, using the body versus traditional talk therapy. But how do you use that in your practice?
Yeah, I think probably like if we're talking about something or processing something, it depends on the age of the client. But if it's like we can't process it any further, sometimes we'll stop and just be like, where does that show up for you in your body? Because for kids especially, I think like talking about connecting thoughts and actions, that's such a big ask, like that is a mature level of thinking to say, I want you to realize what you're thinking and then change that thought so you can have a different action. That is a difficult task, I think, for some adults to even accomplish. But if we can connect them to the feelings in their body, because your body signals way before your actions come out. Your body, like your heart rate picks up. You feel a pit in your stomach. So like bringing awareness to how your body is talking to you, where your body is communicating there is something going on, and like focusing on that, helping to sharpen their meter, their ability to read what's happening, which is also hard, I mean, sometimes that's where we have that first communication of like something is off, is our body is like, this is not okay.
And I don't know about in your practice, but what I've found is kids are pretty good at it. Like with my older clients, it's almost the older they get into adulthood, the harder it is for people to connect like their brains and their bodies. But kids are typically really good at it. So I think you start there and then you kind of build off of that.
Yeah.
Yeah, it's interesting because just listening to you guys talk and thinking, how do I bring trauma-informed care into the exam room? Because I don't have always the time to lead up to build rapport before I'm saying, okay, now let me listen to your heart and let me press on your belly. I mean, very invasive things. And, so I focus a lot on eye contact. Is that child ready to have that amount of eye contact with me, which is just a tiny little thing, but it does allow a child to be in my presence without me being so on top of them, because eye contact is so intimate for so many of our children, and so kind of allowing them to be in the room with me, kind of getting used to who I am and hearing my voice and getting used to their surroundings before I'm turning to them and saying, okay, now let's, examine your body, So I feel like that's a powerful tool in that room to use or to withhold when trying to make a child feel safe.
And then, sorry. I was just going to say other things that I've seen you utilize that I think is really helpful is like asking permission first, before you like charge in and start touching a kid, like asking permission that it's okay, and then, I wish like more providers did this and bigger hospitals would do this, but always allowing a parent's presence, like so many of our kids who've come home and have had to go to hospitals and have all these procedures done, like there's a separation and sometimes a really traumatic separation from parents. And for a kid who's had abandonment, who've had huge separations before from parents, and then they, go into like the exam room or a surgical room and have like these really painful procedures done, like that is super traumatic, So again, like allowing a safe person to be present and talking to the safe person first so that you gain rapport with that safe person before you touch the kid, are all things that I feel like you do too that's really helpful.
I was going to say, I was heading the same direction as Kelly, but was going to add like tone of voice. I think like how you enter the room, your presence, and all of this ties to attunement. Like, and that's like such an important skill that with parents and kids comes from attachment, like when you are attached to your child, when you utilize trauma-informed parenting to create secure attachment, your ability to attune to what your child needs, to read their nonverbal cues is strengthened. And I think that as clinicians working with this population, that is something I see you do, Jennifer, all the time, is just being attuned to your client's emotional state and what they need from you to feel safe in those really quick interactions.
Yeah, it is nice that I have a little bit more time to do that. I think it's hard when you're in a day-to-day pediatric practice or
10 minutes.
and you have 10 minutes. I mean, the easiest thing to do in those situations is allow the child to remain in the parent's lap, not to, like, okay, can we just do the exam or at least start the exam in your lap? That's just a quick, easy, it doesn't take any extra time. But yeah, it's a challenge to create that attunement prior to doing something that could be scary to a child.
And I think the important part is even in environments like we have, like in the counseling office or in the clinic, it's about the relationship, it's about building rapport. And I think that is a huge pillar of trauma-informed care is the relationship. And even in like traditional therapy, the relationship that is built between client and therapist, that's one of the most healing parts of treatment, of therapy. So, whenever I'm having those parent-only intakes before I even see a kid, I tell the parent, like, listen, we're going to have goals. We're going to have, I'm going to talk to you about what your goals as a parent is and about what the child's goals are. But my number one goal is that your child has a positive experience with therapy. That's my number one goal. If we don't accomplish anything else, then I want to accomplish that because, adoption and trauma healing is lifelong. And so, even if that child is not ready to do any big processing, even if like I'm not the best fit, I want that child to have a great experience in therapy so that when they are ready, they're a lot more willing to walk through the therapy door than anything else. So I think that is a huge part of trauma-informed care.
And making them feel safe even coming into the building.
Yeah. Our therapy dogs.
Oh, yes.
Don't forget them.
Yes, we have 2 therapy dogs that kind of help. It just helps the kids take their mind off of what they're here for, and something really happy and something very tangible for them and pleasant, that they can touch and feel and smell and, have that kind of grounding experience. That's been very helpful for our kiddos.
Oh, another important aspect is snacks.
Snacks, yes.
And of course, always ask parents about like allergies and what that kid likes before I start treatment. But I always want at least a few snacks that I know that child will eat because a lot of times they're coming straight from school or they're coming first thing in the morning, and so nutrition, the gut is so much tied to mental health. And so I think snacks are a really important aspect. And then, especially for little kids, incorporating parents in treatment, I think is incredibly important with trauma-informed care.
Yeah, definitely. And I think even onto that is knowing kind of the stress level of the whole family unit, because when you're delivering trauma-informed care, you're not just caring for the child, you're caring for that whole family unit, because our children's trauma impacts us. It brings out all of our childhood triggers or all of our insecurities that we didn't even know we had or we had buried. And then, we can only be that regulating presence to our child as our own nervous system is regulated. And so I think part of trauma-informed care here is knowing where the parent is and what the parent needs and how can we collaborate with them and meet them where they're at.
So like we can't expect our kids to be resilient in the face of their trauma if we're not resilient in the face of ours, and that is just... That's
sprinkle. Write that one down.
Put a quotation around it. No, but for real,
that stirs something deep in me
right
there. I mean, I was like,
that is the hardest part about what we do and about parenting in general.
Yeah, whether you're parenting traumatized children or not.
Right. Yes, it is. You cannot do it well if you don't deal with your own crap as it comes up, and it will come up because we were all raised by imperfect people in imperfect families.
That is very true. And you don't even know what like I said, you don't know what your triggers are
until you start parenting.
Until you start parenting.
Yeah, which is so rude because you're like, I'm going to be a solid parent. I'm going to do pretty well.
Got this.
I'm educated. I'm pretty emotionally stable. And then it's like, you don't even see it coming.
I know. I was like, I'm a pediatrician who does, trauma-informed care every day.
Yeah.
Oh, no. Oh,
I'm
no.
a child and family therapist.
Knock my socks off.
I'm going to be a stellar parent.
Definitely perfect parent.
And not even you, but your partner's stuff too. Which is
that,
a whole different bag of worms.
Yes. Oh my gosh. Yes. You don't even know. I feel like Kelly and I have this conversation all the time. You don't even know who you married until you watch them parent. And then you're like, whoa. All right, here we go.
You better find a counselor for you.
Yes. You learn yourself and your partner in a totally different way when you begin parenting. And man, I hope you got your poop kickers on because you're gonna have to do some work.
You got to be willing,
Yes.
I think that's the big thing. We all have our stuff, but you've got to be willing to.
Yeah. And you can't ask your kid.
Right.
You can't. It's so unfair and wrong to ask your kid to do well in the face of hard things if you can't do it yourself. You have to model it. You have to show them what resilience looks like. Like how do you handle being in the midst of something really hard?
And I think it's important to know too, like we all mess up. Like we talk about it all the time, how, this happened yesterday and I'm going to write that down because my kid's going to be in therapy for that at some point. That's going to be one of the things she's telling her counselor about in 15 years,
Yeah.
So.
But part of trauma-informed care is knowing yourself, and learning yourself and being a student of you and your spouse's own background so that that's not further dysregulating your own child.
Yeah. You have to remain curious.
Yes.
That is you have to stay open and curious to yourself. Don't automatically assume that because it feels big and strong that it's right.
Yeah.
Your kid's behavior made you mad, so that means their behavior's wrong. It's you have to pause and be like, why am I feeling this way? What you have to be curious with yourself, and be willing to answer hard questions to be able to get through and parent well.
Be willing to listen to your spouse when they challenge you about things that you're doing with your kids.
I even think as a clinician, it's that too. This child or this family is harder for me than another one. And what's that bringing up in me? And how can I reevaluate and be curious of how I can best help them?
Yeah. And that's why I love our team so much, because we all, especially when a family does come in for an interdisciplinary, you may have one of our providers really connect with the child and one really connect with the mom. And then we can sit down as a team and say this is what I see showing up for the mom, and this is what I see that the kid needs. And we can work together to wrap around a family and really support them from all angles.
And even in the counseling room, that's why it's so important to have peer-to-peer support so that we can challenge each other. Why are you responding that way? Because you can't operate alone. Right. It's too difficult.
Yeah.
Kind of looking at our own trauma responses as a clinic and how the importance of having a volunteer here that serves our volunteer Patsy, who serves both the patients and the staff. So she's just
she's our regulating body.
She's our regulating
body.
Yes, and just checking to make sure we've eaten, checking to make sure the patient's eaten, and she's not somebody who's down in the deep weeds of all of the problems, but she's in there kind of just being a balm, over the clinic. And I think that has been a very regulating part.
It helps us do our job so much better.
Yeah. Yes.
Just to feel cared for, in the midst of doing hard work, to be to have someone show up and care for you without any ask. Yeah. It's just there. It's just presented as a gift of care. And that is essential as parents, as workers, to our clients who come in, our patients, it's just really nice.
Yeah, we rely a lot in general in the clinic on volunteers who understand our kids.
Yes.
Who understand just the basics of trauma-informed care.
Such a gift.
Yeah.
Yeah. So should we break down maybe what a trauma-informed response might look like? Maybe for ourselves and in the moment as parents, we can speak from how we would guide our patients and clients, or even how it shows up for us as parents?
I think, it kind of goes back to like our number one tenet. And that is like the belief that a child's behavior is trying to tell us something.
Yes.
They're not just being bad. They're not just being disobedient. Hate that word.
Disrespectful.
Or disrespectful. Their behavior is trying to tell us something that they can't tell us. And being curious, like if you are triggered by that behavior, pausing. Like a trauma-informed response would be pausing and not just being reactive, being proactive, and responding with curiosity and nurture, while still like maintaining boundaries. Boundaries is really important too. A lot of people feel like trauma-informed care or gentle parenting or, attachment sensitive parenting, there's no boundaries, but that is the furthest from the truth,
Right. High structure, high nurture. It's like the marriage of both of those things.
It's got to be equal.
Yeah, but I would say like number one thing, like you said, is like that first check-in with yourself, like just taking a pause for a moment, being curious, and if you can, responding to your kid and being like, hey, I'm going to eat a snack for just a moment. I'm going to step over here, or whatever it is that you need, not just like walling up and walking away, because when we have kids who've experienced rejection over and over again, that can be it can create a fear response. But just saying like, hey, I need just a moment. I'm going to be right here, and just having a break, or tagging with your partner, like if you can't do it and they're available, just being like, hey, I need you to step in for a moment. And then you circle back. Once you're regulated, you step in, you connect with your child, and maybe that's not even, you connect with them, not even about the behavior. You create a playful invitation, like whatever that looks like in the moment. You point out something on their shirt or on their shoes or a little freckle on their cheek, and just have a moment of playful connection. And then you lead into like, hey, let's talk about what happened. Like, I saw that you got really upset. You name it for them. Like, what happened? And for some of our kids, big questions can be really triggering. So you have to know developmental age and capabilities of your child. It may look more like you got really upset when your sister came in and dropped her book bag on your foot. Where you don't have as questions, you're doing more directive talk. But you're using playful connection to connect first, then process a little bit, and always following up with nurture. And if you did step away, that's always a good time to be like, hey, I stepped away. That was about me. Your feelings are not too big for me, but I just needed a moment.
Yeah. And I think an important part of that is like how we show up for our kids, like what is the tone of voice that we're using? Are we engaging like them with all of their senses that we can? Are we getting down on their level? Are we utilizing safe touch if our kids are open and able to accept touch from us? All of that matters when you're trying to respond in a trauma-informed way.
I think that's super important to say, even our resting face. What does our resting face look like?
Oh my gosh.
Because for a child has a history of trauma, a neutral face, a neutral resting face is going to be viewed as a negative face. It just is, which is such an unfortunate thing.
Yes, even an anxious child, like
a neurodivergent.
Yes, a neurodivergent anxious child is going to be like, what is wrong? You seem annoyed with me, or you seem mad at me. Yeah, it's like, no, not mad. Just
so having to like hold that happy-ish face. It doesn't have to be, goofy, but that pleasant face and those soft eyes is so regulating. And it's such a mishmash of kind of the way most of us were raised.
Oh my goodness.
It's don't let off the pressure until the child confesses. You feel like I shouldn't be soft at this moment. I shouldn't be playful at this moment, because they just slapped their brother.
Right. And they need to know it was wrong. They need to like feel this.
Right. Yeah. But that doesn't work in our kids.
No, it shuts them down, and they don't learn. I think that's the biggest thing when we look at like consequences and things like that. Is in the moment it creates pain, but it doesn't actually change the behavior. You're just creating this dynamic where it's going to happen again, and now we've got to ante up the consequence. So it's this really ugly cycle.
Right.
But if you utilize connection and relationship, and you are curious with your child, you're more likely to bring about a change in behavior, because that relational piece, that trust and vulnerability, is where change is going to come from.
Because they feel like you're on their team too.
Right.
Even though they need to change behavior, you're on their team and you're going to help them do it, versus, okay, well now I've just learned I've got to be sneaky about it.
Right.
Yeah.
Yeah. And they're not somebody I can trust when I'm in trouble.
Right.
They're not the person I go to when I'm in trouble. They're the
Yes.
person I hide from when I'm
Yeah.
in trouble.
And I think, too, it matters when they're young because we're establishing a relationship dynamic. So when your kid is in big trouble, you know, like when we're teenagers and we have lots of independence and choices and things that we can do, if the relationship pattern you have set up with your child is when I get in trouble, I get a big consequence and I get this negative, like almost like pushed away from my parent instead of pulled close. When I'm in big trouble, the person I'm going to is not my parent. I'm going to go to my friend because that's who I have the relationship with.
Right.
And that's when kids get in more trouble. So you have to parent in the moment for what you want your dynamic and relationship to be like in the future, which is
Exactly.
close. You want them to trust you, and you're not going to trust somebody who's only punitive and only removing things when you make a mistake.
Yeah.
That's the difference. There's a difference between consequences and boundaries, you know, and that's kind of like working that dynamic with your child. So I think just mentioning that difference between consequences and boundaries, you know, that is one of the biggest challenges I think parents face. And that's one of the things that we exist and love to do with families through parent coaching. Because Kelly, you said it best, and you could probably say it again, just the difference between having a child come in and parents come in.
Yeah. I don't remember what I said now.
You really did.
Yeah, well, you were saying like between a child 56, like,
yeah.
you know.
Yeah. I think that some of our favorite work to do is parent coaching because, you know, a parent in the home can elicit so much more healing than we can in 50 to 60 minutes in the therapy room.
Yeah,
so we love to work with parents.
And sometimes you just need an outside perspective. I know I would not have made it through my adoptions without the adoption clinic staff, you know, saying, have you thought about this? Or say it like this, or just somebody to share the burden with.
Right. We do that every day, you know,
gosh,
like we
yes.
come in and say, oh my gosh, this is what I did. And we're like,
I'm in on this action. Desperately in on this action. Go ahead and throw that out. Hard weekend. So, oh my God, so good.
But I do think, I mean, parent coaching is a wonderful way to just learn and to keep yourself regulated and to feed into. It's good for a parent to have as a help to keep them regulated and to walk through how parenting this child is impacting them and impacting their spouse. And it can be done in person. It can also be done via video or telephone in the state of Alabama. So, I'm hoping some of our listening audience would take advantage of that just because it's great for them, but also fun for us too. Yeah, I mean, parent coaching is just, it's kind of a gift that you can give yourself during this really hard time of muddling through. Am I doing things right? This is so hard. I need someone to talk to, or I need some fresh ideas. And that one can be done in person, or it can be done via video, telephone, anywhere in the U.S. And
or abroad. We've done parent coaching for people in other countries too.
Yeah, definitely. And usually it's like 50 to 60 minutes. And sometimes we do weekly, sometimes we do every other week. But it's a big help, and it's also fun for us to walk that path with you. So much of trauma-informed care is done to build connection and to solidify attachment, which is a whole other subject that's large and important. So tune in, and we will talk about that on the next podcast. Thanks so much for joining us.
Thank you for joining the Adoption and Foster Care Clinic for another episode of Beneath the Branches, a podcast for adoptive, foster, and kinship care families. We are deeply grateful to our sponsor, Show Hope, for their generous support and their continued work to break down barriers to adoption and support families every step of the way. Until next time, may you feel covered, connected, and never alone beneath the branches.